Okay, so we're going to get into a few more lower leg injuries and exercise-induced leg pain. So how do we get exercise-induced leg pain? Well, obviously through a lot of exercise, but we can either have it up high where it's showing in that picture where the red is, or we can have it down low on the inside as well. And sometimes we also get it on the outside tibialis anterior. So this is known mostly as shin splints, and that is a jargon term. We don't call it, well, we do call it that, but there is a different name for it as well. So the definition is pain and discomfort in the leg from repetitive activities on hard surfaces or due to forcible, excessive use of the foot flexors. The diagnosis should be limited to musculoskeletal inflammation, excluding stress fractures or ischemic disorders. So, categories of these types of injuries of shin splints would be medial tibial stress syndrome, stress fractures, and compartment syndrome. Those are the three ones that you would look out for. So medial tibial stress syndrome. So we get an inflammation, like we said. We get an inflammation of the posterior tibialis muscle where it attaches onto the tibia. It's showing you there's the common site of shin pain. So medial tibial stress syndrome is an irritation of the tibia or the shin bone at points where the soleus and the tibialis posterior muscles attach to it. It is caused by overuse in runners or other athletes, with those who run on hard surfaces being particularly affected. However, there are a number of factors such as altered foot, knee, hip posture that can predispose a person to the syndrome. So we need to look at other things besides just right on the shin bone. What's going on in the knee? What's going on in the hip? Is it doing something that is causing a mechanical malfunction, and how can we correct it? So, contributing factors: inappropriate footwear. So, let's see. So, if you look here, if the shoes tilt to the inside, then we know that you overpronate. If they stand relatively straight, then you're not bad, you're neutral. If you have no motion control problems, then you have no motion control problems when they're like this, and you're neutral. If they tilt to the outside, then you are an overpronator. So sometimes we need to evaluate your shoe wear pattern. So, you could easily do this if you have a piece of paper, you wet the bottom of your foot and you step onto the piece of paper, and you can kind of see what comes out onto the paper. So right here, you're missing the arch of your foot, right? So you're definitely an underpronator. Oh no. Okay, sorry, we're back. Okay, right here is not bad. It's a neutral. You need a stability shoe. Oh, sorry, back here you need a cushioning shoe. And over here you're an overpronator, and you need a motion control shoe. We need to also look at factors such as foot shape and biomechanics, which I think we just kind of went through. Let's see what I have here. Yeah, so we want to look at what's going on in our gait during heel contact, what's happening mid-stance, heel off, and toe off. We want to look at the lower limb structure abnormalities. We want to see what's going on in the knee. Are they genovalgus, genovarus, or knock-kneed or bow-legged, whatever? What's going on in the hip itself? Is there muscle tightness or imbalance? We want to look at that stuff. Is it poor conditioning? Are they overweight? are they doing too much too soon and they don't have a good cardio background. Inadequate warm-up and training errors. And then what are the surfaces that they are training on? Our next one would be stress fracture. So with the shin splint, if you have that for a prolonged time and you don't seek attention for it or you don't take the proper rest, that can turn into a stress fracture. Again, cause is overuse. So what happens? Usually, again, we're going too far, too fast, not taking the right lead up into exercise. So we get a stress overload. Excessive pronation, usually. Poor running shoes, perhaps. We get what's going on here. We get pain. We get involuntary or voluntary disuse. We keep going. We get muscle atrophy happening. Muscles start wasting away at times. Then the muscle fatigues. Then we get a loss of shock and absorption. And then we get a structural stress to the bone. And then we get, in the remodeling process, we get a stress fracture happening. So the bone can go from a stress fracture to a complete fracture as well. In this instance, this guy just running, the force was so much, he probably had stress fracture, was coping with the pain as best he could, and then in the race, he got a complete fracture happening. Signs and symptoms. Well, we get a lot of point tenderness, really, really local usually. You can pinpoint it. 2, we get a history of increased mileage, really fast usually, so the mileage went up drastically, increase in speed, and a change in surface. We get some swelling, but not always. We want to get an x-ray. Sometimes the x-ray doesn't show anything, so we definitely need to get a bone scan. And we can't see on that. So treatment plan. Well, we want to reduce the stress. Maybe 3 to 6 weeks we need to take rest, or we need to alter what we're doing. We need to alternate, like here we go, I just said that, alternate program for fitness, correction of specific etiological factors, and number 4, we want to carefully reintegrate us back into the activity. Third one, compartment syndrome. You can have an acute compartment syndrome, and you can have a chronic compartment syndrome. So, a compartment syndrome in the lower leg usually happens in tibialis anterior, and we'll see here now if we can, yeah. So,